Welcome to AJ Creations. Let's start our video on pancreas. If you like my videos, don't forget to hit the like button and subscribe to my channel. Let's start the video. In this video, we are going to talk about pancreas and some of the pancreatic disorders. Let's start by saying the location of pancreas. Pancreas is about 6 inches long and located at back side of the abdomen, or we say behind the stomach in simple words. The head of the pancreas is located at the right side of the abdomen, which connects to the first part of the small intestine, the duodenum, through a small tube which is called the pancreatic duct. And the tail is extended to the left side of our body. Now let's talk about the anatomic location of pancreas. Anteriorly, it is in direct contact with the posterior wall of the stomach. Posteriorly, extends to the inferior vena cava, superior mesenteric vessels, splenic vein and our left kidney. Now let's talk briefly about the functions of our pancreas. Our pancreas have both exocrine and endocrine function. Endocrine function deals with the secretion of insulin and other substances within the pancreatic islet that will help in controlling blood sugar and metabolism within the body. In the endocrine function, when the blood glucose is low, the alpha cells will secrete glucagon, which will increase our blood glucose level in our body. When the blood glucose level is high, beta cells will secrete insulin, which will decrease the glucose in our body. The delta cells in the islet cells also secrete somatostatin, which will decrease the release of insulin and glucagon. Now let's go to exocrine function of our pancreas. Exocrine function deals with the secretion of enzyme involved in digesting substances in our digestive tract. As we all know, our pancreas plays a vital role in the digestive system. This is by the secretion of digestive enzymes into the duodenum, which is the first part of our small intestine, which receives the food from the stomach. The enzyme from the pancreas will help to break down carbohydrate, proteins and the lipids, which is the fat. About 1.5 to 3 liters of fluid is secreted in our body every day. Exocrine function, it is 80 to 85% of our pancreas and is made of numerous small glands called the acini. We have talked briefly about the anatomical location and the function of our pancreas. Now let's go to the disorders of pancreas. When we talk about the disorders of pancreas, first we are going to consider about the congenital anomalies of pancreas. There are 5 types of congenital anomalies which I am going to discuss in this video, which is pancreatic agenesis, hypoplasia, ectopia, pancreatic divisum, annular pancreas. So as we were saying, we are first going to discuss about pancreatic agenesis. Agenesis can be partial or complete agenesis. It is by the entire dorsal pancreas or part of dorsal pancreas fails to develop in the body. Pancreatic hypoplasia. It refers to the congenital underdevelopment of the pancreas. It also often refers to a partial agenesis of the pancreas. This agenesis can involve dorsal or even the ventral side of the pancreas. Ectopic pancreas, which refers to pancreatic tissue that lacks anatomical and vascular continuity with main body of the pancreas. Pancreatic divisum. It is the most common congenital anomaly of the pancreas where the dorsal and the ventral pancreatic duct fails to fuse together. Annular pancreas. This is a rare condition in pancreas, which the second part of the duodenum, which is surrounded by the rings of pancreatic tissue, which is continuous with head of the pancreas. The portion of the pancreas can constrict the duodenum that can block or can impair the flow of food. The annular pancreas can be caused by birth defects mainly. 1/3 of the cases of annular pancreas can be by trisomy 21. As we have finished talking about the congenital anomalies of pancreas, Now we are going to move on the pancreatitis. Simply, the pancreatitis means inflammation of our pancreas. It can be caused due to many reasons. Pancreatitis is a rare disease where the pancreas becomes inflamed with a severe pain felt in the abdomen. The pancreatitis can result in damage of the vital organs such as heart, lungs, kidney. When we talk about pancreatitis, it can be acute and chronic. Acute pancreatitis. As the name suggests, it is sudden onset of abdominal pain. It can be result in life-threatening complications, even though majority of the patients with acute pancreatitis, about 80% of patients recovers completely with no problems. 30 to 60% of the patients with acute pancreatitis can be caused by gallstones. The other common cause is alcohol ingestion together, both with together gallstones and alcohol ingestion. It makes about 80% of main cause of acute pancreatitis. Other 10% of cases the causes are unknown, that is it's idiopathic. As we were saying about the causes, there are some medications that can cause acute pancreatitis: azathioprine, thiazide, valproic acid, pentamide, tetracycline, etc. Even trauma can cause acute pancreatitis, but it is to be considered that it is rare conditions which cause due to trauma. It can be post-operative trauma, hyperlipidemia, that is excess amount of fat and fatty substance in our blood, hypercalcemia. As you know, it is an abnormally large amount of calcium in our blood. The other reason is ductal obstructions, infectious agents, etc. Now let's talk about chronic pancreatitis. It is usually the result of long-standing damage to the pancreas, can be due to long-standing alcohol ingestion. It is marked by the severe pain and loss of pancreatic function. More than 90% of the cases are caused by prolonged use of alcohol. Rest of the causes are idiopathic. Even chronic pancreatitis can tend to run in families. That means it can be hereditary. What are the other causes of chronic pancreatitis? It can be topic pancreatitis, hereditary pancreatitis as we have already discussed, hyperparathyroidism, cystic fibrosis, pancreatic divisum. As the last one, the pancreas divisum is an congenital anomaly. We have already spoken about that. We have talked about acute and chronic. Now we are going to talk about the symptoms of chronic pancreatitis. Pain usually contains of radiating to the back. It is the main symptom we see in pancreatitis. Malabsorption of food that lead to weight loss or diarrhea, diabetics, nausea, vomiting, fever, increased heart rate, that means tachycardia. These are the symptoms that commonly we see in chronic pancreatitis. How we are going to diagnose chronic pancreatitis? For diagnosis, we can check the level of digestive enzymes in the blood, such as amylase and lipase. The higher the level of these two enzymes suggests that the strongly an acute pancreatitis. As the patient recovers, the enzymes will decrease and reach the normal level. Chronic is suspected only when there is a heavy symptoms and there is a history of long-term alcohol use as a risk factor. What tests we can run for pancreatitis? What are the tests we can run for pancreatitis confirmation? It can be pancreatic function tests, X-ray of the pancreas, CT scan, retrograde pancreatography, etc. other tests. These can show the pancreas is inflamed. Even ultrasound scan is being considered because if there is an acute pancreatitis, there may be a chance of gallstone which is causing this pancreatitis. I hope you like this video. Don't forget to hit the like button and subscribe to my channel. This helps me a lot in bringing new videos in front of you. See you in the next one. Bye.